Scars, whether caused by injury, acne, surgery, scars can serve as unwanted reminders of past traumas. Most scars do fade over time, even if they never entirely go away. Some scars are more stubborn than others, and while they don't cause any pain or health problems, they can contribute to significant emotional stress depending on their location, let's say on the face. If your self-esteem has taken a hit thanks to your scars, you're probably here looking for some ways to make them minimize or disappear. So very quickly, if this is your first time on my channel, my name is Maria and welcome to Aglaia Aesthetics Online. I'm an aesthetics instructor, an esthetician, an aesthetics examiner for many years. Give me comments below. Love to connect with you either here or Instagram. If you have not subscribed yet, please consider it. Click on the notification bell so when I'm on, you're here. So let's get started. Let me describe the different type of scars. The appearance of acne scars depends on the type of skin inflammation that caused it, and they may result in either of a depressed or raised scarring tissue. The atrophic scar go deep into the surface of the skin, often sharing the characteristics of shallow, irregular-shaped depressions. Some common types of atrophic scars are the boxcar scar, ice pick scar, and the rolling scar. So let me describe a little bit between the difference of these scars. The boxcar scars have a deep angular shape underneath the skin surface and are often formed around the cheek area or the temples. These are commonly caused by severe form of acne. Now the next one is the ice pick scar, and our deepest type of acne scarring. Small in diameter but really deep. Due to its depth, it may be difficult to remove with traditional acne scar removal methods. Now the next one is the rolling scar tissue, or the widest form of atrophic acne scar, and may appear as wide as 5 millimeters in diameter. Similar to the boxcar scars, rolling scars are a result of severe inflammation deep into the tissue, into the dermis layer. Now, the difference between the atrophic and the hypertrophic and keloid acne, bearing the opposite characteristics of the atrophic scars. They may develop above the skin surface and look like small raised bumps. This is a resulting of healing scar tissue, usually really fast healing process, usually in the area where the acne once was. Now the hypertrophic and keloid scars differ in size. Where the hypertrophic scar may form around the same size as the acne that was healed, the keloid scar may develop in shape and spread around the surrounding area. The next one is the post-inflammatory hyperpigmentation, also called the PIH. Can occur after any type of acne, including the small pimples. It is a natural part of healing in the skin. So now that we know most of the different scar tissues, let's go over some tips and tricks to minimize the appearance of scars. The first thing, most of all, the most important thing is stay cautious in the sun. Some people conclude that getting some additional color from the sun would actually help the scars blend in or fade away. On the contrary, too much sun exposure can actually cause further discoloration in the scars, and the scar tissue is more susceptible to sun damage than the rest of your skin. So, for these reasons, protect your scars from the sun radiation. The best way to do this, including staying out of the sun for prolonged periods of time, applying mineral sunscreen. I say mineral sunscreens because they don't have chemicals to your skin. You don't want to add that to your skin. When spending time outdoors, seek shade. Wear protective clothing and wide brim hats. I would like to talk right now about chemical exfoliators. These can help remove the outer layer of the skin, leaving a smoother appearance. These ingredients that may help the appearance of scars. Salicylic acid helps clear out dirt, skin cells, and other debris that leads to acne from the pores of the skin, because the pores get clogged and there's a formation of acne. It also helps reduce swelling and redness in the area, which may minimize the appearance of scarring. Salicylic acid is beneficial for all skin types, mainly oily, acne, and all different types of scars. The next ingredient is retinoid. Some topical retinoids, and you know that I'm not too fond of this ingredient, may, however, help get rid of acne scars. These topical retinoids block inflammation, reduce acne lesions, and speed up cell regeneration and repair. It can also help lighten hyperpigmentation scars, including individuals with darker skin tones. It is important, however, to note that retinoids can make the skin sensitive to the sun, and it should not be used in long term. So if you decide to take this, be very careful when you go in the sun. The next ingredient is the alpha hydroxy acid, or also called the AHAs. They can help get rid of the surface dead cells and prevent clogged pores. This process may help with discoloration due to scarring. Next active ingredient is lactic acid, and a lot of times the AHAs, you do have lactic acid and malic acid. You have different kinds of acids, and these can act as a gentle peel to pull away dead skin cells. It may help reduce the appearance of scars and smooth the overall texture of the skin. Lactic acid may also help lighten dark scar tissue. Now, before using any of these ingredients that I mentioned, it is best to do a patch test for these products to see if you have any allergies towards these active ingredients. Mechanical exfoliators such as microdermabrasion. It is a non-invasive cosmetic procedure that resurfaces like a sandblasting of the skin, rejuvenates the face, and physically removes the top layer of the skin. This process improves the skin's texture and reduces the appearance of blemishes. Be very careful not to do this procedure on active blemishes. And if you do it, be very careful not to go directly into the sun, because the skin becomes very, very photosensitive. Microneedling is one of the treatments that I totally love, but it needs to be done very carefully, and also you might want to go to an esthetician or to a dermatologist. However, if you do have small little needles, it can also be done at home. Be very careful not to overdo it. Monthly, it's okay. I do have a tutorial that explains the length and the needles, and it's really good. So check that at the end of this video. Microneedling is a process of inserting tiny little needles, making little channels into the skin, surrounding the scar to stimulate the body to make more collagen. This collagen may reduce the appearance of acne scars by smoothing out the skin. It is also an amazing treatment for anti-aging. Okay, so now some natural remedies that they do work. See which one works best for you. Try not to do them all every day. Just try to see which one is best for you. So the first one is aloe vera. It is an anti-inflammatory and has antibacterial properties, so is a great tool in your acne scar treatment. So first of all, you will need to have an actual aloe vera leaf. Cut it, scoop out the gel, put in a couple, 2 to 3 drops of tea tree essential oil. Mix it and then apply directly onto the scar tissue. Leave it on for about 10 to 15 minutes and then rinse it with cool water. You can do this once a day. Another one that you might want to try, it's lemon. This one here works as a natural bleach, helps lighten the skin scar of your skin. It removes dead cells, promotes new cells, cell growth, and improves skin elasticity. So what do you do? Apply fresh lemon juice directly onto the scar with your fingertip or Q-tip. Leave it on for about 10 minutes and then rinse it with cool water. And you can repeat this once or twice a day. Another thing that you can do is mix equal amount of lemon and honey. Mix it together and you can apply onto the scar tissue. Again, leave it for 10-15 minutes and then rinse it with water, pat dry, and you can repeat this once a day. Another thing that you can do with lemon juice is equal amount. It's lemon juice and vitamin E. And mix it together, apply onto the acne scar, and this you can leave it, go to bed, leave it all night long, and then in the morning you just rinse it and apply your moisturizer. Coconut oil, it is a great source of vitamin E and fatty acids. What you can do is mix few drops of lavender oil in a teaspoon of coconut oil, and then you mix it, you apply onto the scar, massage it for about 5 minutes, leave it for about an hour, and then you can rinse it with warm water, and you can do this once or twice a day. Vitamin E oil, it is an antioxidant to repair the skin, so it helps greatly, and you can mix this in any ingredient. So you just take a vitamin E, puncture it, squeeze the oil, and apply directly onto the scar tissue. Apply before nighttime, leave it overnight, rinse it in the morning. Baking soda works as a mild exfoliator to help fade the scar tissue. Get 2 teaspoons of baking soda in a bowl, add a little bit of water to make a thin paste. Apply the mixture onto the scar tissues. Leave it for a couple of minutes, then rinse it off. Now you can also massage it, and that becomes more of a mechanical scrub. You can repeat this once a day for several weeks to help fade the scar tissue. Please remember not to overdo it, not to irritate your skin. I know sometimes individual becomes over eagerly to scrub away until they're all red. That will go against the purpose of skin resurfacing, so be very careful. Another ingredient that I love, and you know that if you follow me, is apple cider vinegar. The acidity property of the apple cider vinegar helps to lighten the pigmentation of the skin. It brings back the balance, the pH balance of the skin. It also stimulates the collagen production, repairs the cells, and removes dead cells. So basically what you would like to do, get a tablespoon of apple cider vinegar, 1/4 cup of water, and put in a tablespoon of honey. Mix it well and then apply it onto the scar area. Leave it approximately 10 to 15 minutes, then rinse it. Repeat this daily. Yes, potato. The high starch content helps to fade the scars and the blemish. Cut in thick slices, rub it onto the skin for a minute or so. Leave the potato juice on your skin for about 15 to 20 minutes and then rinse it. Now, all these treatments, be very, very careful not to irritate your blemishes. So you have to keep a very close eye that you're not overstimulating the skin. Cocoa butter gets easily absorbed into the skin, locking in the moisture. Remember, even though you have an oily skin, you need that moisture to help regrow the regrowth of the tissue, reducing the scars. Apply a small amount of cocoa butter directly onto the scar. Massage it in until it's absorbed. Repeat daily before you go to bed, and then wash it in the morning. Turmeric is one of my favorite ingredients. Curcumin is the active ingredient in turmeric. It is loaded with skin healing properties. It also has anti-inflammatory properties. Mix 1 tablespoon of turmeric powder with a little bit of lemon juice to make a paste. Then you can apply directly onto the scar. Wash it after about 15 minutes with warm water. Pat dry and then apply a moisturizer. You can do this daily. Another concoction that I find it's amazing, mix 1 teaspoon of turmeric powder, 1 tablespoon of plain yogurt, 1 teaspoon of coconut oil, apply onto the scar or scars, allow it to dry so it becomes a little bit dry, then wash it off gently, and you can do this 2 or 3 times a week. Oh wow, honey. The honey has antibiotic and healing properties. It can help treat acne as well to help with your scars. You can apply raw honey onto the scar tissue, just a little bit, put a bandage and go, leave it and go to sleep. In the morning, take off the bandage, wash it with warm water, and you can do this every night. Okay, the next one you will love. Take an aspirin, crush it into a powder. The aspirin has salicylic acid. Mix it into a teaspoon of honey. Remember the benefits of honey? Mix it nicely, apply onto the scar and leave it for about 15 to 20 minutes. Then you want to wash it with lukewarm water, and you can do this once a day. Have you ever heard of high frequency? I have a tutorial and I'm going to upload it at the end of this tutorial. The high frequency treatment are specifically developed for treatment of acne and acne scarring. During this treatment, a glass electrode is applied to the skin, creating a sparking effect. This effect eliminates bacteria and inflammation deep within the tissue and the pimple. Can also stimulate the collagen in the skin. Amazing. These devices and all these links, I will put them down below. Also, to have a good skincare is essential. Remember not to overuse products to overload the skin with tons of active ingredients. So when you're doing these treatments, be very careful that you are very careful not to overstimulate the skin, because you do not want to cause any damage of your acid mantle. So if after all this you feel that you want something a little bit more aggressive, then you will need to go into the medical treatments, and you will need to contact a dermatologist that will be able to help you with different kinds of more evasive treatments. Some of the medical treatments for scars include chemical peels. Now remember that these are very evasive. A dermatologist can recommend a type of peel that is suitable for a person's skin type, acne severity, and scarring. Injections of corticosteroids may help with treatment of raised acne scars tissue if a person has either hypertrophic or keloid scars. This may help. Dermofillers. Dermatologists may choose a filler that consists of collagen-based products. this may require some testing so you don't have any allergy reaction. Basically, the fillers will fill the indented scar. Laser treatments is another option. It removes the uppermost layer of the skin to reveal the younger skin cells underneath, which can help reduce the appearance of scarring. Laser treatment is not suitable for every skin type, so you have to be very careful. Do your research. The treatment may also cause a reaction to some people, especially those with very sensitive skin types. I hope that you found this video to be useful and walk away with simple and easy tips that will give you steps, procedures, good skincare, different routines, different devices without overspending and unnecessarily irritating your skin. An opportunity to pamper yourself. Remember to treat yourself with utmost respect. Until the next time, take care.